Hi, good afternoon. My name is Bree Cowart. I am a registered nurse, psychiatric mental health board certified, and I'm going to be reviewing a cognitive behavioral therapy case study with you today. After reading Brittany's case study, we definitely want to develop a problem list. So first, there is an identifiable stressor, which is her recent move. She has had a change in behavior. She used to be described as well behaved, that she did well in school, she participated in extracurricular activities, and she had goals to be a veterinarian. Since the move, she's exhibited signs and symptoms of failing chemistry, have a decreased interest in school and activities. She's been argumentative and disrespectful towards her authority figures, such as her teachers and parents and other students. She's been fighting with other students. She's been refusing to do chores and homework at home. She's had a lot of anger, agitation, irritability, depressed mood, and isolation. And another thing is that she doesn't want to talk about this with her parents because in her mind, her belief is that they deserve what they get for moving her in the first place. So in therapy, you want to work kind of at your patient's pace. We're going to prioritize the themes that she has, and with her, this is her preference of how she wants to work with things. So first, we're going to work on the new school. She thinks it's too easy and the teachers are closed-minded. So in her mind, she feels like her input does not matter, and that's kind of like her theme. The next one is she missed her friends. The new friends were very different in the culture, and so in her mind, she feels like she's alone and none of her peers will ever accept her. And then Brittany's parents have changed her life, so in her mind, she feels like she has no control of things in her life. So the diagnosis that I feel like fits appropriately for Brittany is adjustment disorder with mixed disturbance of emotions and conduct. She's having emotional problems such as depression, anxiety, and then she's also having disturbance in conduct with her lashing out with other students, fighting with them, being disrespectful towards her teachers, and being argumentative towards them. And then here is just the criteria for adjustment disorder. They have to have an identifiable stressor. In this case, within 3 months. And then in Brittany's case, it was the move. She has to have marked distress, out of proportion of severity of the stressor, and which she does with being argumentative, having detention. It's definitely causing distress in her life towards her family and her school. And that has to do with the next one, having significant impairment of social, occupational, other important areas of her life. And it doesn't meet criteria for any other mental disorder, in which at this time she does not. And she's not having any bereavement at this time. My differential diagnoses are oppositional defiant disorder and major depressive disorder. If you look at the criteria for oppositional defiant disorder, she does meet a lot of the symptoms in that disorder, but since the recent move, it's only been about 3 months since she started having these behaviors, and in order to have a diagnosis of oppositional defiant disorder, you have to have those for at least 6 months. So right now she wouldn't meet criteria for oppositional defiant disorder, but if her behaviors continue over the next 3 months, up to 6 months or more, then she could potentially meet the criteria for this diagnosis, and you could add it to her diagnoses. The next one is major depressive disorder. Brittany does have some symptoms of depression, but she doesn't meet criteria for the full amount of major depressive disorder. She only has 2 out of the 8 symptoms, and in order to meet criteria, you have to have 5 out of the 8 symptoms. So with CBT, for interventions and outcomes, you want to label your cognitive distortions. So you would give homework to the patient to identify cognitive distortions and then identify what distortions that they're using. So with her theme of none of her peers would ever accept her, that is all or nothing thinking, jumping to conclusions. Her interventions that you can use is the one for this one is examining the evidence. Instead of assuming your negative thought is true, accept the actual evidence of it. And the outcome that we want is that Brittany found no actual or factual evidence to support her unrealistic fear that every student in the school will reject her. And as a result, she described in the future that she didn't have a crystal ball that she could look into to see that, one day she may be able to have friends. Another intervention that you can use with this is assertiveness training, especially with like teens and with kids. This can help teach the child or the teen interpersonal skills that can help them intervene and make appropriate expressions and initiate talking to other people. So the next intervention and outcome for Brittany is looking at the theme that all of her teachers at school are closed-minded and not worth listening to. This is labeling, overgeneralization, and jumping to conclusions. The intervention that they used is the survey method, and this asks people questions to find out if their thoughts and attitudes are realistic. And as far as talking to other people. And the outcome that they got for Brittany is now she listens to her teachers and evaluates whether or not they are closed-minded before she decides whether to speak disrespectful to them. And this decreases the amount of time she gets in trouble and has detention, which is improving her behavior. The next theme is that I have no control of my life. This is overgeneralization, mental filter, and control fallacy, in which in this case she's blaming her family and her parents of not having a control in her life. The interventions that can be used for this is cognitive restructuring, grief and acceptance reality and coping, and writing down a positive opposite. Not every intervention works with everyone, so you would need to have several available to see what works for her. So with cognitive restructuring, instead of accepting this false belief that leads you to think negative thoughts about your parents, take the opportunity to think of what they are doing to try to help you during the transition with the move. And then that could be a way to help. Next, educate her that she has no control over the situation and the circumstance, and that she needs to mourn and grieve her old life, and hopefully she'll be able to accept her new life. You need to educate that there is bad news, that at times in life, everyone in life has little control over other people, or no control over other people. But the good news is that we have full control over our choices and what we do in our life. And then you can ask her questions like, what do you want in the long run? And what constructive steps can you take in that direction? Help her become part of the solution to the problem. And then writing down a positive opposite. That task includes writing down a statement about the move and what the best outcome would be with moving. Because, she can't change that she's moved to where she's at, but she can possibly change her outlook of what she thinks, what she wants it to be like when she moved, and then working towards those steps to get to that outcome. So for Brittany's outcome, she will learn to accept that she has moved to a new place. She will begin to think of things that have happened since the move, focus more on the here and now, and identify steps to create a solution for her change and her way of thinking, and reconstruct that her parents are here to help, cope, and to help solve problems. So, what cognitive behavioral techniques might be appropriate to use with Brittany as she explores her angry feelings towards her parents who want her to be her old self, an identity that Brittany clearly rejects? So far we have talked about assertiveness training and how that can help her initiate conversations with other students. The fact that she's got to let go and mourn her old life and try to accept her new life. Writing down a positive opposite, and cognitive restructuring. Other interventions that can be used are mindfulness meditation. This is to help with depressive symptoms, to help her stay grounded in the present instead of the past, where she thanks and blames her parents for her situation. Another intervention is visualize the best parts of your day. You can have her write down positive things that have happened to you today. or while she's at school, what are some good things that have happened. And then another intervention is family session. You can eventually hopefully get a family session in where you can discuss the patient struggles, identify the family dynamics, and educate the patient and family on interventions and the expectations, because the family may want her to be her old self, but she might not be that old self anymore. She may transition to a new self just with her new identity at a new place. And so you need to make sure that the expectations are explained, and interventions are explained to not only the adolescent but also to the family, so that way you both have a plan on what you want to achieve. So here's a list of goals that I made for Brittany. If she was my patient, I would want her to improve her overall self-esteem and confidence level. I'd want her to feel more comfortable with talking and conversing with her classmates and teachers at school. I would want her to take the time to listen to others before acting in a defensive manner. I would want her to think of positive things that have happened since the move. I would want her to identify things that she can control in her life. And I'd want her to try to accept her new life. I also would want her to make new goals of things she could do in the next year. So adolescence is a time of social experimentation and identity development. So how would a cognitive behavioral therapist determine what portion of Brittany's feelings of not fitting in are consistent with her developmental stage, and what portion are indicative of social skills difficulties? So I looked at Erik Erikson's stages of development to help me identify what is normal and what is not normal. So for adolescents 12 to 18 years old, you're looking at Erikson's conflict of identity versus role confusion. So during this stage, adolescents search for a sense of self and personality through looking at personal beliefs, values, and their goals. So if they're at success at this stage, it'll lead to fidelity, which is accepting others. And if they're not, a failure to establish a role leads to role confusion. And this is not being sure about themselves in the place in society. And that's kind of where Brittany's at right now. She's not sure, she's not sure who she fits in with. And what she wants to do at this time. And this often leads to an identity crisis, in which the adolescent may begin to experiment with different lifestyles, in which she is doing that. She has changed her hair color to pink, she's pierced her lip, and she's trying to experiment to find out where she fits in at in her life right now. Some social skill difficulties include having decreased self-esteem and confidence, inability to feel comfortable talking to other students due to her race, culture, and interests, and then conflict resolution. She's fighting with other students, and this is showing that she does have some social skill difficulties that we need to work on. So in the clinical setting, some things that we can use to help identify these to help them transition is by using developmental screeners. And this should be done with their primary care physician, and then also with your mental health. If they're doing well, do a whole child assessment screener to see what we can improve on. Strengths and difficulties questionnaire, the PHQ-9 modified for teens as far as looking for suicidality. Some resources that are really good to help with this are the CDC and Bright Futures websites, and this pretty much lays it out there. It has a lot of good education on what to expect, teaching for the student, teaching for the parents, and how to help transition their lives to meet their role in life and to transition into the next role. So how would you use cognitive behavioral therapy techniques in a culturally sensitive manner to address Brittany's feelings about being the only biracial student in her class? So first, you need to have a non-judgmental therapeutic relationship. You need to be able to recognize diversity issues and shape your counseling practice to fit the client's worldview. I cannot assume that I know where she's coming from, and I'll need to consider her worldview and her background about things. And I need to understand that there is no one ideal therapeutic approach, and as a practitioner, I must be willing to be flexible and be willing to modify therapy approaches to meet the need of the individual and their situation. Because with psych, it's not textbook, not every therapy is going to work for everyone. So we need to be able to understand that if it's not working correctly, we need to take a step back. We need to reassess the situation and then try a different intervention. So how might the principles from REBT be applied to Brittany's case study? So the basis of REBT is that we cause our own psychiatric problems by holding rigid and extreme beliefs. So Brittany is holding on to her old life. REBT will help her realize that she's holding on to the past and will allow her to create a new cognitive construct so she can reframe her belief and move forward. Robert Ellis is the one who came up with this model, and it involves using the ABCDE method. So first you have your activating event, which is her move. B is her emotional behavior, such as her anger, irritability, mad, defiant, and feeling alone. C is the consequences, which is, being in trouble with her parents and her teachers. D is disputing those thoughts and identifying the thoughts. You want to detect them, debate them, and then discriminate them. And then E, effective philosophy, replacing the unhealthy, irrational thoughts with healthy ones. These are my resources, and y'all have a great day.